Welcome back to the channel, everyone. Today I'll be speaking to individuals experiencing digestive issues beyond Irritable Bowel Syndrome, IBS, who are seeking dietary guidance for conditions like SIBO, GERD, Histamine Intolerance, and others. While Irritable Bowel Syndrome, or IBS, is a commonly discussed digestive issue, many individuals face other specific challenges that can significantly impact their daily lives. Today, we're going beyond IBS to explore dietary strategies for managing other distinct digestive conditions. If you've been navigating digestive discomfort that doesn't quite fit the mold of IBS, this video is for you. We'll touch upon a few key conditions and the dietary approaches that may offer relief. Remember, this information is for educational purposes and should not replace personalized medical advice. Always consult with your doctor or a registered dietitian for a proper diagnosis and tailored treatment plan. 1. Small Intestinal Bacterial Overgrowth, SIBO. Let's start with Small Intestinal Bacterial Overgrowth, or SIBO. This condition involves an excessive amount of bacteria, often types that are normally found in the large intestine, growing in the small intestine. This overgrowth can interfere with nutrient absorption and lead to symptoms like bloating, gas, abdominal pain, and diarrhea or constipation. Dietary management for SIBO often involves a phased approach, with the initial focus on reducing fermentable carbohydrates that feed the bacteria. Common approaches include the low-FODMAP diet. FODMAP means fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. While often associated with IBS, the initial restrictive phase of the low-FODMAP diet can help reduce overall fermentation in the small intestine. This involves temporarily limiting foods high in fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. The specific carbohydrate diet, SCD. The SCD is another dietary approach that restricts complex carbohydrates and processed foods, focusing on easily digestible monosaccharides and disaccharides. Elemental diet, under medical supervision. In some cases, a doctor may recommend a short-term elemental diet, which provides all necessary nutrients in a predigested liquid form, essentially starving the bacteria. It's crucial to work with a healthcare professional experienced in SIBO to determine the most appropriate dietary approach and to reintroduce food strategically as symptoms improve. 2. Gastroesophageal reflux disease, GERD, commonly known as acid reflux. This occurs when stomach acid frequently flows back up into the esophagus, causing irritation and symptoms like heartburn, regurgitation, and sometimes even chest pain or difficulty swallowing. While medication is often necessary, dietary modifications can play a significant role in managing GERD symptoms. A. Identify and avoid trigger foods. Common culprits include fatty and fried foods, chocolate, caffeine, alcohol, citrus fruits, tomatoes and tomato-based products, peppermint, and spicy foods. Keeping a food diary can help identify your personal triggers. B. Smaller, more frequent meals. Eating large meals can increase pressure on the stomach and make reflux more likely. Opt for smaller, more frequent meals throughout the day. C. Avoid eating before bed. Give your stomach time to empty before lying down to reduce the risk of acid refluxing into the esophagus. D. Elevate the head of your bed. While not a dietary change, this can significantly help reduce nighttime reflux. It's important to note that trigger food can vary from person to person, so careful observation and potentially an elimination diet under guidance can be helpful. 3. Histamine intolerance. Another less commonly discussed but significant digestive issue is histamine intolerance. Histamine is a natural chemical in the body and in certain foods. Individuals with histamine intolerance have difficulty breaking down histamine, leading to a range of symptoms that can include digestive upset, skin rashes, headaches, fatigue, and more. Managing histamine intolerance often involves a low-histamine diet, which focuses on avoiding high-histamine foods. This includes aged cheeses, fermented foods like sauerkraut and kombucha, smoked and processed meats, dried fruits, shellfish, spinach, tomatoes, eggplant, and avocados, among others. Choosing freshly prepared foods. Histamine levels in foods can increase with storage time. Opt for freshly cooked meals and consume leftovers quickly. Understanding histamine liberators. Some foods don't contain high levels of histamine themselves, but can trigger the release of histamine in the body. These include citrus fruits, bananas, strawberries, and chocolate. A low-histamine diet can be quite restrictive, so working with a healthcare professional or a dietitian experienced in this area is crucial to ensure nutritional adequacy and proper guidance. 4. Other digestive conditions and dietary considerations. Beyond SIBO, GERD, and histamine intolerance, there are many other digestive conditions where diet plays a vital role in management. Inflammatory bowel disease, IBD, Crohn's disease, and ulcerative colitis. Dietary approaches for IBD are highly individualized and often involve managing flare-ups with easily digestible foods, potentially following a low-residue diet during active inflammation, and working with a dietitian to identify trigger foods and ensure nutrient needs are met. Celiac disease. The cornerstone of managing celiac disease is a strict gluten-free diet, eliminating all sources of wheat, barley, and rye to prevent damage to the small intestine. Diverticular disease. For diverticulosis, a high-fiber diet is often recommended to promote regular bowel movements and prevent diverticulitis. During a flare-up of diverticulitis, a low-fiber diet may be necessary. For all these conditions, personalized dietary guidance from a healthcare professional is paramount. What works for one person may not work for another, and nutritional needs can vary significantly. Navigating digestive issues beyond IBS can feel complex, but understanding the potential role of diet can be a powerful step towards managing your symptoms and improving your quality of life. Remember, the information shared today is a starting point. If you're dealing with any of these conditions, please prioritize consulting with your doctor or a registered dietitian for a proper diagnosis and a tailored dietary plan that meets your individual needs. What are your experiences or questions related to managing digestive issues with diet? Share them in the comment below. Your insights can help others. If you found this video informative, please give it a thumbs up and subscribe for more content on health and well-being. Thank you for watching, and we wish you the best on your journey to digestive health. We'll see you in the next video.